Hi, it's Dr. Dan Purser, danpursermd.com. Welcome to my Facebook Live. Tonight it's on birth control options and nightmares or problems, and a little bit on fibromyalgia. So please remember to follow me on Facebook, Twitter, Instagram, Pinterest. Get on my email list on danpursermd.com or Physician Designed. That's DESIGNED website. You can buy all our supplements there right now for 25% off. And free shipping, right? Mm-hmm. So they win all the way around.
But
We're
have
like
to...
bigger than Amazon and way better.
There's a coupon code for that. You have to use the coupon code HOLIDAY 25% off.
What?
That's the coupon code.
Do they spell OFF on there? Or,
yeah.
Of course.
Yeah, they do.
I'm joking. How else do you say it? Okay. Holiday code 25% off. Wait,
No.
What is it?
Coupon code is HOLIDAYS 25%
Holidays,
yes.
25% off. Is it 25 percentage sign?
Yep, correct.
Off. That's all one word?
All one word.
Holidays, 25% off. Make sure you put that on there. I just heard that. They don't give me 25% off when I buy supplements. They just take all my money. Okay. So our 85% solution, our genetic MTHFR book, that was number one for 2 years on Amazon until just a while back, the last year. It's now still 99 cents. And all the blood and genetic testing you're going to hear us talk about maybe tonight, or you hear us talking about, you can get on my website, danpursermd.com. You make an appointment at danpursermd.com also. And don't forget fibromyalgia. Go to End Fibromyalgia with Natural Options, the Facebook fan page that Lois Schweigert runs. Thank you, Lois. All you women with fibro, you got to at least go check it out. It's free to check out. Come on. Go check it out. Get on the low-copper diet and prove to yourself that it really works for your fibro. I'm going to keep it that simple. Oh, you had something I was supposed to say about potatoes. They're really delicious when fried in butter.
But they're extremely high in copper. And so people were saying, I don't eat any kale or avocados or spinach, but I love French fries. And it's like, that's your trigger.
They're high in copper, especially fried foods.
Yep. Because a lot of them are fried in oils, like peanut oil and... Right?
So I haven't been working today. Well, I have been working a little today.
You've been wearing your Disney shirt all day, haven't you?
I'm dreaming.
Stand up a little so they can see.
It's been so long since I've been to Disney World or Disneyland. Sorry, I think I've forgotten what it was like. What is it like?
It's really nice. I was just there this week.
What?
Really rainy, though.
I wasn't there this week. I was seeing patients.
He was.
Yeah, I was working.
Ditched him.
Yeah, I did not work today, though. I went to church and taught Sunday school and then came home and...
Cried a little?
I cry a lot. So all my Purser books can be bought at greatmedebooks.com.
Yep.
And then awesome, Great Med Ebooks. Okay, known problems with birth control options. You saw me post this, or you saw, hopefully some of you seen that I posted this. For the sake of this discussion tonight, let's call these modern birth control options, all in capital letters, modern birth control options. We're going to call them that. I'm lumping all the birth control pills, Depo-Provera, and the Mirena IUD into this group. Mirena has always been thought to be not a problem with breast cancer until you read their studies, and until they read their studies, or until the FDA read their studies about a year ago and realized, wow, they still increase breast cancer risk 250%, just like all the others do. So modern birth control options are super inflammatory. So everything that follows in this list is related to or caused by that inflammation.
What causes that inflammation? I thought progesterone was like anti-inflammatory.
They don't have progesterone in them. None of them do. They have progestational agents or progestins, INS, in them. Those are synthetic. They're not even chemically similar to progesterone. And they're very inflammatory. They're synthetic. The idea is for them to be inflammatory. That's how they shut down your cycle and mess with your ovaries and everything. So they're very inflammatory. And they get focused in your breasts, which these modern birth control options increase breast cancer risk at least 250% in adults.
Why is that?
Because they're so inflammatory. They change the breast cells, they mutate them, they damage them, they change your genetics in your breasts and other places, so you develop cancers. That's why.
Holy cow.
So in girls 18 or under, though, because their breasts and tissues are so fresh and haven't fully formed yet, these are from 2 Northern European studies that have been highly suppressed here in the U.S., but they increase breast cancer risk and death by breast cancer risk 500%.
Wow.
For a lifetime if you take them prior to age 18 or younger. So all these 15, 16, 17-year-old girls taking birth control pills, they get a 500+% lifetime risk of death from breast cancer. We used to see, when I first started practice 35 years ago, there was a big peak of breast cancer at age 65, which was 15 years after menopause, and you'd been out of progesterone for a long time. And maybe, taking birth control pills later in life or something like that. And then now we see a bimodal peak, one at 35, one at 65. The 35-year-olds are thought to be all those girls who took birth control pills prior to age 18.
Because so many doctors are putting them on birth control for acne and like regulating their period and right.
I think it's a death. I think it's a death sentence. I wouldn't do it.
You
I think
mentioned
it's that bad. I'm really serious about this. The data is really firm on that. So
yeah, I know you never let any of us ever.
I wouldn't treat acne with it for sure. I wouldn't treat PMS. There's so much better options like natural progesterone.
Completely.
And natural progesterone will help clear your skin up too.
Totally.
Look at you. You look like a supermodel from Sweden now. What's up with that?
I actually had a really bad acne growing up, and it definitely has gotten under control as I've taken natural progesterone and done all my other vitamins too. I feel like
What are you rubbing something on your face?
Actually, I'm putting the cosmetic glutathione on my forehead because I do have a scar there from my childhood, and then I have wrinkles because I'm getting older. And I feel like it's...
Yeah, you're like 22 now.
I'm 23.
Okay.
But I feel like I'm very
Wrinkles at
expressive
23.
with my eyebrows, and I've been putting on, and I feel like it's been helping. So kind of random tip. Try it out and let me know.
Well, we did that study for New Skin once a while back, and it showed that it dramatically increased inflammation of acne and helped with scarring.
Oh, totally.
But glutathione, the NIH says it should do that, and it does do that, the real glutathione. So, okay, back to this.
Yeah.
So, modern birth control options, those I discussed, the Mirena, the Depo-Provera, and other injectables, and all the birth control pills increase breast cancer risk dramatically. They're 250 to 500+% a lifetime risk of death. And that is in the U.S. just like it is in Europe. And that's why we're seeing that big peak at 35. Birth control pills do not regulate cycles. They just force you to hemorrhage regularly. Sorry, I'm checking this list. I've got a really extensive list I wrote up before we started tonight.
So what does that mean? They don't force your cycle. They just force you to hemorrhage? What does that even mean?
Yeah, it's exactly what you're doing. You're just hemorrhaging once a month. The original designers of the first birth control pills, which I think was by Dow, don't hold me to that, maybe it's Pfizer, but they thought women would think it's more natural if they hemorrhaged once a month, even though they're not having a period. You're not cycling. You're not having a period. You're just withdrawal hemorrhaging. That's all you're doing. And when some doctor says, well, this will regulate your period, no, it regulates your hemorrhaging. It's not regulating anything. Yeah.
That sounds bad. Like, that does not sound good.
It's not good. It's all, the whole idea is bad. So modern birth control options will cause someone with significant methylation problems like MTHFR to feel crazy or suicidal. I ask that question all the time to my new methylation patients. Did you try? They'll say, I'm so depressed, I'm so fatigued, I'm so exhausted. I'm sitting there looking at them. They have blonde hair, blue eyes. I'm thinking, wow, you're Swedish and you're a Viking descent and you probably have MTHFR. And so when have you ever taken birth control pills? And their husbands will start kind of this nervous laughter by him, and this 28-year-old girl will go, yeah, and it made me crazy as a bat. I'm like, okay. So that and prenatals they can't take.
Yeah.
Because they can't detox the medicines and the pills. They can't detoxify properly. So
or they can't even process them right.
They can't process them. Yeah, it'll make them crazy or suicidal. And I've had lots of girls come in and go, I tried to commit suicide. They put me on birth control pills 3 months later. I tried to kill myself. I
So
couldn't handle it. I
sad.
was going crazy. So, also modern birth control options will cause someone with genetic factor V Leiden to clot. So we always look for it in the Pro 7. We look for that specifically, as in strokes, pulmonary embolism, or deep vein thrombosis. They should not be on any of those birth control options. Could you imagine injecting Depo-Provera pellets into those women, and you put them in underneath their arm here, and what that does to them? It makes them crazy, and they start clotting and doing all this other stuff. It's just bad. It's just a nightmare.
That
So,
sounds like it.
also, that these modern birth control options don't prevent or protect you from any diseases. They just cause a lot of medical problems downstream. And I'm the guy to help you recover from those problems. So, my favorite long-term birth control option for most is the copper IUD. But if you have fibromyalgia, that can even worsen fibromyalgia.
Because of the copper.
Yeah, because we think copper toxicity issues and copper metallothionein dysfunction, again, go to end fibromyalgia with natural options, is the main problem. So copper IUD, bad choice. So it kind of leaves you with just condoms, abstinence, unless you're married, and other methods like the vaginal cap and things like that.
Yeah.
So foams, things like that. It's just not very good options, but it is what it is. It's better than dying from breast cancer.
It's totally
So,
true.
Also, these modern birth control options, the Mirena, the Depo-Provera, and the Mirena, Depo-Provera, and the birth control pills are common cause of women's hair loss or thinning of hair. They're very androgenic, and they usually cause a lot of weight gain too. So weight gain, hair loss, get a mustache. That's what causes all that. You have any questions there you want to ask me?
Yeah, from what people are asking.
No.
Wait, what did you say? I'm still kind of thinking about the copper IUD because I know a lot of people who have thought about that option. But you said it's bad for people with fibromyalgia.
Right, the copper leaks into them and it keeps them chronically ill.
Man.
For some reason, they have these genetic issues. We think fibro patients, they definitely have methylation problems. But they have some other genetic issue that they can't handle extra copper, especially the massive amounts women take in and a lot of men take in nowadays, eating green smoothies, kale shakes,
Potatoes,
avocados, potatoes, fried potatoes.
mushrooms,
So you got to watch all that.
almonds. So what can you do to like regulate your cycles and just have a good menstruation,
Very carefully use natural progesterone as your options. Make sure you don't have any vitamin deficiencies causing your ovaries not to produce adequate quantities of progesterone. If you're one of the young girls who need help with all this, and if you're married, you just got to go with a condom or some other option for birth control. So it's the same thing I've been preaching to everyone about: endometriosis, PCOS, and bad PMS. You just got to use natural progesterone, a lot of it. And you can even suppress your cycle down to where it's even a few hours or not at all. It does not mean you're not ovulating. Some of you are going to ask that. It doesn't mean that. You still can ovulate quietly without bleeding or anything. It may not implant, but I wouldn't depend on it as a birth control method.
Yeah. Interesting. So what do you do for endometriosis? You kind of just mentioned that a little.
A lot of natural progesterone. I was reading through the questions earlier, and a lady was like, what do you do with abdominal or colonic or intestinal endometriosis, where the endometrial inflammatory particles fall on the colon or small bowel or ileum or wherever, and causes chronic inflammation. You take natural progesterone to get rid of it. Lots of it. Or try Progestins Plus to begin with. If you're not a Young Living distributor and don't know anyone, you could try Progestavel by Designs for Health. It's another topical serum progesterone. But Progestins Plus is what the majority of the people following me would probably use to begin with. If that doesn't work, it works with 80 or 90%, but not with everyone, then you need to go to a prescription.
Get a heavier dose.
Yeah.
That's what I've been on for years. I take Progestins Plus a lot too, but I kind of do both.
Yeah, I know you do.
Because my family is very deficient in progesterone. What do you do for PCOS?
Same thing. Make sure there's no vitamin deficiencies. They all have MTHFR. They have vitamin deficiencies. Get a SpectraCell. Get methylation studies, and also treat with a lot of natural progesterone. Again, it's not going to give them birth control options, but they have a hard time getting pregnant anyway.
Yeah.
So most of them can't. I hear a lot from a lot of them that they're having problems with that.
Yeah.
Mainly because they're incredibly vitamin deficient, have bad methylation issues, and have a lot of inflammation going on.
Yeah. Just a mess. What about women who are in menopause when they get on the pill? Why would they even get put on the pill in menopause?
Doctors do that hoping, because they don't know what else to use to help with hot flashes, night sweats, stuff like that, so they put them on the pill instead. I remember 30 plus years ago I did that.
Man.
Yeah, shoot me up. I'm going to have to answer for that in the next one. I just didn't know better. Most doctors don't know better. Now I'd give them lots of natural progesterone. It helps with the hot flashes, night sweats, maybe some testosterone, and definitely a little estradiol, either topically or orally.
What if, so we're kind of getting into other kind of people's questions more and more, but
Okay.
what if you're 33 and not on any protection and develop a blood clot or a stroke? Does that kind of relate?
Yeah, you better. First thing I'd do if you're 33, that's really young, I'd get a homocysteine level, have your doctor get it, and see how bad your MTHFR and other issues are. They're going to be bad. So if you have a high homocysteine level, that's what causes strokes, heart attacks in younger people, blood clots, things like that. And they'll clot to birth control pills very readily too.
And do you find that a lot of people with high homocysteine have MTHFR?
They all do.
Always. Interesting.
There's no way to have high homocysteine. So homocysteine directly converts to glutathione. So it goes from one of the most evil substances in your body. You convert it over to one of the most important detoxifying substances in your body. And then you do that all through the methylation pathway, through MTHFR and other genetic genes we've gotten over the years. So,
Man. Interesting. If you take enough natural or bioidentical progesterone, wouldn't it act like a birth control? You kind of mentioned this earlier.
No. Yeah, no. Well, it could in theory, but and I know patients have tried that and it works sometimes. I don't know. I think it's a crapshoot. I don't know if you'd know. I don't know if you could tell for sure. I wouldn't risk it. So
what progesterones can you use if you do have factor V Leiden? Like, is there just not birth controls or?
Can't use birth control pills. You can use natural progesterone.
No problem.
Yeah, no problem.
Cool.
Oral, topical. Your doctor may disagree, but I disagree with them.
Yeah.
So talk to your doctor first, of course. Don't do it just because I said so.
Just because you said so. Someone asked, what's your favorite ride at Walt Disney World?
Oh, it would be People Mover. It's slow. It's nice on a hot day and a hot evening. Nice and cool. It's in Tomorrowland in Magic Kingdom.
Perfect ride for an old man, right?
Yeah, but I don't. So I don't know. I'm not an old man. So.
It's a good ride for a grandpa, right?
Right, not a grandpa. Okay,
You
I'm
are
a grandpa.
Can birth control pills cause dryness?
Yes. Yeah, vaginal dryness. Yeah, it can. Often does, even in younger women. Why? Because it's very androgenic, and it's and it shuts down all your hormone production, all of it. Shuts down your testosterone, your estradiol, your progesterone. Shuts it all down. Shuts your ovaries down, so you don't cycle. So yeah, you're going to be really depleted of hormone. So you're going to lose your libido, and you're going to get really dry.
Crazy.
Not everyone does, but a lot do. So the first thing I have to do with those patients, get them off the birth control pill, and then we wait. 3 to 6 months later, if they're still dry, then I start doing. I'll do a SpectraCell on them to see what vitamin deficiency they have that's causing them not to start producing testosterone.
Interesting. What do you find is usually the most common?
B12, folate.
B12. Interesting.
Pentothenate. Why do you think that is? Why can't they absorb adequate amounts of B12 and folate into their cells?
MTHFR?
Yeah, or other methylation problems. Yeah.
Other methylation. Yeah, wow. So
You've listened at these.
I'm learning, right?
Yeah, I think you know a lot more than you want to learn
I'm
on.
just kidding. I feel like I know a lot. Someone asked, what if they're not using any protection, and they're still having dryness down there? What's usually the cause? You kind of mentioned this.
It could be perimenopausal. They could be menopausal. They might have vitamin deficiencies. A lot of perimenopausal cases occur prematurely because the woman has a lot of vitamin deficiencies, and so good vitamins or good nutrition in equals good hormones out. And so she's 42 in perimenopause, or 32 or 48 or 48, you kind of should be in perimenopause maybe, but it's according to what her mom and her sisters have gone through menopause, if you can get that data.
And what can you do?
Give them vitamins.
Oh, yeah. Just
if you need to, give them testosterone cream.
And then kind of along the same lines, menopause can cause dryness, right? And what do you do about that? Is it kind of the same vitamins? Or
95% of the time, no, it's low testosterone. They've quit producing. Their ovaries have failed. It's ovarian failure, and it's genetically programmed. But so you can give them testosterone cream. 3% of the time, it's lack of estradiol. 2% of the time, it's lack of progesterone, and less than 1% of the time, it's due to lack of DHEA.
Interesting.
We have a ton of questions.
Yeah, we have a ton of questions people are asking too. I'm kind of mixing from all your posts and everything, but I think this is an interesting one. Are there symptoms that you can expect after going off of birth control pills after 20 plus years? And what's the best way to kind of go about getting off birth control pills after taking them for a long time?
I would take a lot of natural progesterone. I don't know why you're on them for 20 years, maybe just for protection. I'd still take some natural progesterone to ease the path.
Yeah.
Maybe Progestin Plus or some Progestil, something you get over the counter.
What symptoms do you think they'll expect usually to see?
They might hot flash, night sweat. It's going to be weird getting your ovaries functioning again.
Do you think
it takes 3 to 6 to 9 months for that to happen? If they don't by then, you got to wonder what vitamin deficiencies you gained in those 20 years.
Yeah. What would help reduce the risks if they were on birth control pills from age 16 to 26 and they're currently 28? Yeah.
Lots of natural progesterone. American College of Epidemiology study 1981. Yeah, it's still apropos, still appropriate for today. These are really smart people looking at tons of studies prior to 1981. The natural progesterone has been used for decades and decades. And way before a lot of you were even born, probably. But that's why it's so weird that gets bad-mouthed so much. But they found that healthy progesterone level, serum progesterone level, let's say above 10 nanograms per deciliter, anyway, you get a 500% decreased risk of breast cancer, 1,000% decreased risk of all cancers overall.
Wow. That's not something they tell you.
So if you took birth control pills prior to age 18 and you're worried about that risk, you can kind of negate it by getting on natural progesterone and really hammering it, staying on it.
Yeah.
And do everything else you can to reduce your risk for breast cancer. And there's a lot. Get my breast cancer patient survival guide.
Yeah. Has a lot of preventative stuff in there.
That's mostly what it has.
Yeah. Does taking birth control pills for an extended time period affect your possibility of conceiving or getting pregnant? Or
I know a lot of people think that. It shouldn't, but I think it does, the inflammation stuff. Who knows what trauma and scarring and everything else you've gotten down there the time you've been on them, so it's hard to say.
Does supplementing progesterone help produce more estrogen and testosterone and get you all balanced, or not really?
You can.
It should help you start feeling better regardless.
A lot better, yeah.
Yeah.
It won't get you balanced. I don't know if I like that term. It's according to how old you are and where you're at in your fertility cycle and everything else.
Interesting. What are your thoughts on the Mirena IUD, especially for those with MTHFR?
I don't think it's an option.
For anyone ever?
I don't. I mean, you know what you're getting into. They used to say it didn't cause breast cancer risk. Now they've admitted that causes 250% increased risk, just like birth control pills. It'll also cause clots, strokes, heart attacks. Just know it's the same thing as taking the pill. Just as bad.
Yeah.
in every way.
Same.
Use a copper IUD instead.
We've gotten a couple questions about like getting testing. So say like someone asked, they just did the Pro7 test and they have their Mirena IUD. Will that throw off the results at all? Yeah, because it's
a
genetic
test.
Yeah.
Right. It won't throw anything off. It'll just throw your hormone level testing off. Don't get your hormone levels checked while you have a Mirena, and they're going to be flat. They're going to be 0 or close.
Dang. What about, does the Pro7 test or give any information regarding hormones, or does it just like...
Yeah, well, indirectly, it'll tell me what your genetics are and how they affect your ability to make hormones. Yeah.
Cool.
But it's an indirect measurement. It's not going to say your progesterone
exactly.
levels 20 nanograms per... No, it doesn't say that.
But it will show that you could have problems absorbing
Especially with low test. If you're ATG16L1, by the way, double homozygous or even double heterozygous, you'll have a hard time making testosterone. It just comes with that genetic error.
Interesting. Someone asked, what will help them conceive? They have endometriosis and their periods are very irregular. Sometimes they don't even have them for 6 months.
Natural progesterone's their only hope. Maybe no, that's not true. Natural progesterone's not their only hope. They need to get, if they really want to conceive, spend the money on getting methylation testing. Our foundation methylation kit, I get that. It's only a couple $100 plus. Get a SpectraCell. That's where you're going to spend most of the money, and see where you're at. There lies your answer to your endometriosis, more than likely, oddly enough, and there lies the answer to your probable infertility. Would be my guess.
That's good to know.
I mean, I don't know for sure, but I'd say 95% chance.
So would you say the SpectraCell is the best test to get when you want to test your vitamins? Sorry.
Yeah, there's no other option.
That's the best one.
I know people get serum levels all the time or whatever, but those are so inaccurate compared to a SpectraCell.
Cool. Good to know. PD8020 is something that PCOS patients should not take.
Right.
Okay. Someone just was asking about that, and they said they
Do
want
not
to take
PD8020 if you have PCOS.
What do you recommend for PCOS patients again?
Lots of natural progesterone.
Cool.
Get your thyroid checked too, but mainly focus on your genetics and how to get a SpectraCell. Same with endo. You treat them kind of the same way. You deal with their genetic issues, and you deal with their methylation issues. Mostly, they have bad methylation issues, and you deal with their vitamin deficiencies they've got, and you can get them a lot better, if not complete resolution of their so-called PCOS within a year.
Interesting.
Clearly, that's not going to be 100%, but it's still pretty good.
Yeah. If someone has a lot of scarring from taking birth control pills for so long, what's the best approach for conceiving?
What I've said.
Natural progesterone?
Natural progesterone, increase your glutathione intake, use some of our VARs or whatever. I'd use the VARs, glutathione, rub it on your tummy, and the cosmetic. Are we doing a sale with that?
Yeah, we weren't going to, but we've had so many people asking. So the VARs cosmetic, it's the only one we have in stock right now. We're working on getting our mint burst back. But
it should be the next 3 or 4 weeks.
We're hoping at the new year. We're hoping. So but try the cosmetic. It's really great. It's 25% off, so it should be around just under $75, I think. We were not going to drop that because it's very expensive to make, but we are excited. And it's a great product.
Once it's gone.
It's gone. So we don't want to do this, but you guys have been wanting VARs, and it's everyone could use it, no matter what age you are or anything. It's amazing. So
thank you for that.
Like I said, I use it on my face every night. I know I'm not supposed to use it at night. Don't listen to me.
I use it every day too. I just take it orally.
I love it. Will taking natural progesterone affect your thyroid at all?
No.
Okay. Is the Paragard IUD a safe birth control?
Yes.
Okay.
Unless you have fibro.
Do you find like IUDs are the best?
If you've had a baby.
Yeah. How come not before a baby?
They don't fit.
Oh, interesting. Learning new things.
Sorry.
No, it's good. So someone's been told they have a thickened endometrial lining. The only options the doctor gave them were birth control pills or 7 days of progesterone each month, 3 days after day 1 of their cycle. Are there better options?
Well, that's natural progesterone. I'd do it.
Yeah.
So you can thin it out. They're trying to get you to slough it.
Yeah.
So if not, you're going to probably be faced with a DNC to see what, and really they're just kind of pulling that out, scraping that out so they can run it through pathology and see what that is. That's kind of a little bit alarming, but probably not. But I do the natural progesterone option. It might be 14 days. So what would they say? 7 days after the third day of the
7 days. Let me scroll back.
Oh, yeah, please.
They said 7 days of progesterone each month, 3 weeks after day one. I assume.
Day one of what?
I assume of their cycle, but maybe
After their period's over.
I don't know. They just said after day one. I just kind of assumed.
Confusing. Okay. Yeah, I do 14 days, but that's just me.
I take it every day.
Yeah, I'd consider that too.
Yeah.
But they're trying to get them to withdraw bleed.
Yeah, so maybe.
So then you got to go off the progesterone list
for a little bit.
Yeah, 14 days on, 14 days off.
So birth control does cause scarring, right?
A little can, especially at the cellular level.
Why would it do that?
Inflammation.
Oh, that makes sense.
Progestational agents, synthetic progestins, all that, and birth control pills, though they're not, this is probably a little extreme, please forgive me for this, but they're kind of like gasoline, you're pouring it in there. This is really toxic. But that's the idea, it's supposed to be. So you don't cycle.
Interesting.
Shut those ovaries down, beat them up.
So if you
like they're hitting them.
hitting them. So take natural progesterone daily. I think it's the same person.
I'm pretty much a fan of that approach, but younger girls, I will tell them to use it around the time of their cycle.
Yeah.
Maybe, and for 7 days thereafter or whatever, stuff like that. So I'm not a big cycler with progesterone. It's too complicated for most humans. Too complicated for me, maybe.
Yeah. It would confuse me too. I just stay on it.
I stay confused.
Just go write the people mover and you'll be okay.
And now over and over. I'm the guy that does this on it, and then they let me write it again.
So for these people who have been taking birth control pills and they want to stop, is it best just to stop cold turkey, or should you kind of finish the pack?
Finish the pack.
Okay. And wean yourself off, or just stop taking it after you finish the pack?
I'd get on natural progesterone first and then finish the pack.
So you can take both at the same time?
You can take both and should if you're going to get off.
Okay, interesting.
Get on the natural progesterone. If you can't get it locally, go to a compounding pharmacy, ask them who a good doctor is. If that doesn't help, call me, 801-796-7667. That's our office number, and set up some time. Or go to danpersonmd.com and set up a 30-minute appointment. Still $250 for the first visit.
Yeah, we're doing holiday initial consultation pricing, half off.
And when that ends, are we taking it to 3,000 like I've asked?
We're going back. No, just kidding. We're going high. No, I don't know yet.
How come I'm not in charge of all that?
You're not
anymore?
in charge. Just kidding. No, you are in charge. I
I'm
was
not in
joking earlier.
charge.
He always tries to fire me every day just because he can. So I said, I'm going to fire him someday, and it's going to be just nice.
Okay,
kidding.
I need you guys to vote. Who should fire who? Should I fire her? That's Brecca, my stepdaughter, or should she fire me?
Let's explain the situation. He's tried to fire me every single day for the past
She's mouthy.
7 years.
No boss should take that abuse.
But I think I should someday fire him just for fun.
Well, give it a vote, yay or nay, and let us know that if we get 1,000 votes, it'll be great.
What's a good natural progesterone options again? Do you want to repeat all of them?
Progestins Plus, Progestavail. Call my office if you want some of that. It's physician only product that designs for health cells, but I know the guy who makes it. But it's for physicians only. We'll give you a really good price plus no shipping costs on that. We're better than Amazon. We're bigger too, but
Getting there.
okay, eventually one day, maybe never. But also, you can go to your doctor, ask for Prometrium or generic Prometrium, Prometrium, or if they just laugh at you and throw you out at the office and scold you, go to a compounding pharmacy near you and ask them for a good doctor will prescribe their compounded progesterone capsules. If you really have a good compounding pharmacy near you, they'll have RDTs. Download my little book, Progesterone. It's been #1 on Amazon like 8 times for a reason. And it's been up there for years. It's a great book. And it tells you all those options so you know what to do.
Yeah. Is there a natural alternative to spironolactone for PCOS?
Yeah, DCI, decarolinositol by Chiral Balance, or ZAZ according to the age.
Interesting. Those are...
But you need to know your genetics. But yeah, try it. Go look up, go to the Chiral Balance website and read about decarolinositol.
Is the cost of natural progesterone, like prescription, pretty high or
No, it's reasonable.
not too bad?
Yeah, you can go some places like California, places like that, and get it compounded. It's crazy expensive.
Yeah. I know the Prometrium's cheaper than compounding for sure.
Generic Prometrium is
Yeah.
synthetic, or name brand Prometrium made by Big
Yeah,
Pharma.
generic.
Will break your bank. You'll need to go get a loan and sell your 3 cars and probably your husband to get it. So
how
it's hard to
much-
find
Yeah,
the generic Prometrium.
to go somewhere special.
Yeah,
How much natural progesterone should you take while you're transitioning
varies
off of birth control?
a lot until it makes you sleepy the next day. That's called a progesterone hangover.
I like those.
No, you don't.
Helps me sleep.
Yeah, well, it helps. Yeah, when it's
The wake
giving
up
you a
is
good
the
night's
worst,
sleep.
though.
Yeah.
Yeah.
Yeah, if you're sleeping until The Price is Right is coming on, that's at 11. Yeah, almost everywhere in the U.S., maybe 10. You're taking too much. That's a progesterone hangover you're having.
That does hurt. But sometimes it's nice when you need to sleep.
My wife takes a lot of progesterone. She takes the RDTs, and she curls up in a ball and crashes she sleeps solid for 7 or 8 hours.
Yeah. It helps me sleep through the night so much better.
Yeah, and I know naturopaths and chiropractors and stuff have been suggesting it for men, but I wouldn't do that. It's pro-inflammatory for men. It's just the opposite the way it works for women.
Not good.
Yeah, very inflammatory.
So someone said they have had endometriosis for years. They're 35, and they said they've been diagnosed since they were 18. They've had several surgeries, currently on the Mirena. So they want to get this removed and get their body back to semi-normal. About how long do you think that would take?
I don't know how long it's going to take you to get the Mirena out, so it can vary, but probably get it all figured out in 6 months easy.
Yeah.
And be a lot better. Go to Google, my Google reviews. I think some of my endometriosis cases have left reviews. Read those. Search endometriosis in those and read them. You'll see how fast it is. It's quick. There's no reason to goof around with it. Give you lots of natural progesterone, cools things off. Figure out why the heck you have endometriosis to begin with. Why aren't you producing enough progesterone? It may just be you just need a lot of extra progesterone. Or it could be that you got chronic vitamin deficiencies caused by genetic errors. And you got to deal with that. But either way, let's get rid of it.
Yeah. So someone asked, if they get their Mirena IUD removed, what do they recommend to help stop the lining from thickening as it was before? They said they were trying to use natural progesterone, specifically Progestin Plus, and it wasn't helping as much as they thought it was going to, and was told they either had to go on a Mirena or face an ablation. They're 36.
I don't even know on that one. That's tricky. I'd still, they all look get thick. So when they slough their lining, that's the heavy bleeding that endometriosis cases get.
Yeah.
So again, you just got to figure it all out before you get off the Mirena, and then dial it in and take your natural progesterone, cycle it if you need to. Maybe go double dose the second 14 weeks of the month and half dose the
days?
first 14. 14 days. Sorry.
Yeah, that's tricky.
But it can be done. I do it all the time.
This is random. This is just a good idea. Someone said, can you do a live video someday to go over each test you offer at your office and report what the reports look like and the info that the patients will get? They'd love to see what these are and be educated on what they are. I think it's really great.
Okay, we'll do that the next Facebook Live.
Yeah, we can do that.
And we'll also talk about men's testosterone.
Yeah.
How I fix that problem.
Cool. 2 in 1.
I'm in for a real treat then, aren't I?
This is Jackson. He suddenly appeared. He's been sitting here the whole time. He's just silent.
No, I think that's a great idea.
Why
though.
is that, Jackson?
I'm not saying anything about my testosterone. It could be higher. That's all. No, I think that's a great idea. Though we can do a Facebook Live or even make another video just explaining what all of our tests are and why you recommend each of them and for what.
Because we know it's really confusing. There's so many different things.
We're working on a flow chart as well.
Yes.
Flow chart.
Uh-huh.
Just to make it easier.
Okay. Flow chart. Are you going to put in one of those pictograph things?
Uh-huh. We're having Melissa work on it.
Okay. Yeah, Melissa won't come on my Facebook Lives anymore.
You scared her away.
I think it's totally fair game to talk about someone's dress size on my
Okay,
Facebook
let's talk
Lives.
about your dress size. I think you
I
do
haven't worn
a
a dress.
woman's.
I haven't worn a dress ever.
Uh-huh.
Wait,
No, I'm just
you
kidding.
you did go by Daniela for a little while.
No.
We call him Daniela as a joke sometimes when he's acting like a
I'm
diva.
anyone but Daniela.
That was a deeper voice than
I
normal.
am. I'm a real man.
He's a man's man.
No, I mean, no.
No, isn't that the term?
Yeah, not anymore.
Okay. Back to progesterone. Let's get back to this. Or I guess
Let's
we're
get
even
off
on
this
birth
other
control.
stuff, yeah.
Let's but is there a certain dose that's good to start at with natural progesterone, especially when you have
Start low, go slow.
Start low, always. Start low, go slow.
Go tiny. Yeah, except where you got severe endometriosis and I'm talking to you.
You're gonna need
I'm
some.
going to probably go with the 200 milligram compounded progesterone, 200 milligram RDT. That's for rapid dissolve treat. Put it under your tongue. And I'll say start with one, but take as many as you need. Because I have progesterone patients who take endometriosis patients who are severe who take 12 to 15 at night. I have 8 of those. I know the exact number still. Because one out of about 100 or 200 women have severe endometriosis that have endometriosis. And it's about 1 out of 100. And that's I care about 800 or 900 endometriosis cases. And the rest take 2 or 3, maybe 2
Cool.
of the RDT, so 400 milligrams a night. But that's all getting into their bloodstream too.
Yeah. Good to know. This woman has a 19-year-old daughter who has a regular cycle, but extremes to have extreme menstrual mood swings. Is there something that you can?
Yeah, natural progesterone, it elevates mood, it gets rid of depression the next morning, makes women happy, makes men.
Woman's feel-good
sad.
hormone.
That's what I call my book, Progesterone Women's Feel-Good Hormone.
So you'd say if you're having irritability, usually you should try raising your progesterone dosage?
Try raising your progesterone.
Cool.
Yep.
How do you know your intake and or levels of hormones are at, and when you should know, and when will you know?
Check blood levels
Yeah.
with someone who's knowledgeable. Have me look at them. Hey, pay for 15 minutes of my time. I'll look at them.
Is there a way to know you're over supplementing with like progesterone?
Yeah,
or-
if you're sleepy
Yeah,
the next day.
a little bit too much.
I don't know if I'd go by blood levels with progesterone because severe endometriosis cases, they have really high blood levels of progesterone, but they have no more pain, no more inflammation. They're happy as can be. They're out jogging, running. They're living normal lives, really, and they're off all the stuff they're on for endometriosis. And they take natural progesterone. They are happy. Of course, it makes women happy, unnaturally so, but and they're sleeping like babies, but they love that. They love it.
I love it. Someone has a 10-year-old daughter who isn't menstruating yet, but is definitely having mood swings. Is there something she can do for her?
Little progestins plus maybe drop her too around that time.
Yeah.
She's starting to pattern her cycles.
Yeah.
Happens. We've
does.
had daughters do that.
That was me, right?
I'm not saying.
I was one of those people who would cry.
I'm not saying.
I'm telling them. I was the kind of person who would laugh and then cry and then laugh. I was so weird. I don't really do that anymore. This lady, this is kind of more of a comment, and I'm interested. She's convinced that being on the depot shot threw her hormones out of whack, and it took 5 years for her to
Good.
get her body
I
back.
can see that.
Yeah,
Yeah. Sorry, I should have mentioned that earlier. Yeah, there are cases that take a long time.
it's interesting. How do they get their periods teen back in control when all she wants to do is take birth control pills?
Routine?
Yeah, she said, like, the comment was that the doctor is telling her daughter that she needs to be on birth control, but she doesn't want her daughter on birth control.
Well, are you in a state that you have no say, like New York
Yeah.
or California or somewhere?
I don't know.
I don't want to break any laws or suggest you do, but there are states that they take control and they'll go after you if you don't listen to them. But if you're in a state where that's not the case, and she's not sexually active, I would stop buying the pills for her. Stop
Yeah.
them and put her on natural progesterone.
Because that will help regulate your period
It will.
better than the birth control pills, because they just make you hemorrhage, I've learned.
Yeah, it's not
It's
regulating
terrifying.
jack.
Yeah.
No, that's just regulating your scheduled bleed-a-thon every month.
Shark Week.
Pretty much. Don't go swimming then.
Yeah. Can you share the study about the percentage of the cancer and birth control, or where people can find it with the 250 and then the 500 for teens?
Yeah, it's in my book, The Breast Cancer Patient Survival Guide. There's several studies listed.
Cool.
Yeah, I never say anything unless I can back it up with
Yeah,
the data.
no, of course, yeah. People were wondering where they can find that.
Yeah, my Breast Cancer Patient Survival Guide.
Yeah, great
Download
resource.
it, go in there, highlight it, and put it in front of people.
Does tubal litigation...
So let me clarify.
back.
That study was the original study was done. I want to say it was in either Norway or Finland or somewhere, in a small town with a lot of women. People never leave their towns there, their communities, and so they could track them all medically through the socialized healthcare system, and it shocked the study, the professors, the doctors doing the study, and they published it, and everyone was kind of stunned by it. And so it was repeated in the next country over. Like, that's what I want to say. It was Sweden or Denmark or somewhere. They're in there, and I can't remember where they were, but both Northern European studies that were peer-reviewed and everything. And got the same results. And so they concluded that don't give girls prior to age 18 birth control pills. Of course, the data has kind of been suppressed. As you can imagine, you haven't heard about it here in the U.S., I found it on PubMed, clearly, because I referenced everything. So,
Yeah, it's all there.
yeah.
What about, does tubal litigation cause problems?
Well, tubal ligation, bilateral,
I said
BTL, we called it bacon, tomato, and lettuce, but it's really bilateral tubal ligation. You get that done after you're through having babies or for whatever reason. And no.
Okay. What about vasectomies? Can that cause problems for men? I've seen that a couple of times.
When they script the vasectomy, yeah, I've seen that happen a couple of times.
Yeah. Interesting.
But usually not. Usually 99.999% of the time, no.
So this lady, she said she loved to know how to cope until your body regulates on your own after getting off birth control pills. She feels like she tried getting off them at the beginning of the year and then had to go back on 3 months later because she just felt so horrible. So
maybe stay on them and face the music, but another option is take more progesterone. Lots of it are taking enough
or
problem.
maybe not at all.
You're maybe just trying some little tiny drops of this or that, and you need to hammer it.
Yeah.
That'd be my only suggestion. Get a
Progesterone.
spectroscope, find out what is going on. Do a really careful of
In-depth.
eval. Yeah.
Yeah. This is just kind of a comment too, but it's a nightmare. It sounds like a nightmare. She said, I ended up with a pulmonary embolism this summer after expelling 2 IUDs and trying estrogen again. She's been anemic, so she has weekly iron injections, and now she's heading for a hysterectomy in 2 weeks. And she's just like, I can't believe how naive I was to it all and the problems it causes. So that sounds like a nightmare.
So why are you not, okay, back up.
Yep.
So whoever you are, you ever,
I don't have her name.
So for example, a few weeks ago, I had a patient
I actually do have her name.
who, tell me her name.
Her name's Cannon Becker Richards.
Okay, Cannon Becker Richards. Listen to this. Anyone else out there who's gone through this kind of stuff, you can't get your iron level back up. They have to inject iron. They're doing all this stuff. You have a B vitamin problem. You have a B vitamin absorption problem. Because if you're low in riboflavin or B12 or pantothenate or biotin or any of those, you can't properly absorb iron. I see that all the time. I had a riboflavin deficiency show up on a spectral a while back, and she said, well, I'm so tired all the time, but I'm also got an iron deficiency anemia. They've never been able to resolve. I have to go in and get blood. I get injectable iron, all this stuff. And I was like, what? And you can look up riboflavin deficiency blocks your ability to absorb iron. And so same with the B12 deficiency. And so you have some kind of methylation problem. Do you deal with that first before you go start having things removed? You get a spectrum, so you got so much going on. I'd say just slow down on some of the stuff, and let's do a more careful evaluation. If you want to call me. I'm here. 801-796-7667. Well, I'll be in my office tomorrow. You call there or leave a message, but or email me at email us at info@danpursermd.com. But yeah, I'll bet I'm right.
Yeah.
That you have some kind of B vitamin problem, thus the crazy heavy periods, thus the endometriosis, thus all the other nightmare stuff you've got going on. You could probably vitamin deficient as heck, and that's why you can't absorb iron properly too.
So interesting. Riboflavin.
That's why you do a SpectraCell. Yeah, who'd have guessed riboflavin
Never.
deficiency, really?
Yeah.
I mean, yeah, what are the symptoms of that? I don't know. I wrote a book about it. I looked them up at the time, but I forgot. But one of it is you can't absorb iron.
Wow. That's crazy how much you
Ferritin, iron, all that.
you don't realize your body's doing all that while you're just sitting here.
Yeah.
It's crazy.
Sorry I mentioned your name, but they can all read it.
That way then maybe she heard and she can take a step back and look. People always say that progesterone plus can't be used unless you want to conceive because it increases fertility. Is there truth to that?
It does increase fertility in some people.
But that's not the only use for it.
No, it's not.
Definitely
Actually, not the use for it hardly ever. So,
what are the birth control options without using birth control pills again?
condoms, abstinence, the cap foams, the copper IUD, vasectomy for the hubs,
tubes tied,
BTL, bacon, tomatoes, and all those. Or tubal ligation.
bacon.
Or tubal litigation, whatever you want to call it.
What's your opinion on copper IUDs and hair loss? Do you think there's a connection there, or do you think it's something else?
Something else.
Do you think
Spencer David Coburn wrote a book called The Bald Truth about women's hair loss? You need to get that. Let me summarize it in one sentence. It's all about vitamin deficiencies. Women's alopecia is almost always caused, or hair loss is almost always caused by some kind of mineral or vitamin deficiency. Guess what we use when we're in a cosmetic reconstructive surgery office? I get a lot of hair loss cases in there from women, and we get a SpectraCell, and there lies the problem almost always. And sometimes it'll give me patterns that make me go, you should get some genetic testing too. Mm-hmm. But often I just give them their vitamins, and 6 months later they come back with a full head of hair.
I know which ones it is, usually, right? Isn't it zinc and selenium?
Those are big causes of biotin too. Very common deficiency, and B12 even.
Wow.
B12 is the most common deficiency I see.
Yeah, that's interesting.
And they tell me they have gut problems. They think they have a gluten intolerance. They have immense fatigue. They're exhausted. Their hormones are all screwed up. Everything else. Guess what? 3 months later, ain't happening. They're great. 6 months later, 9 months later, everything's working fine. Just because we dealt with the proper deficiencies. Good nutrition or good vitamins in equals good hormones out.
Makes sense.
And good hair out.
Good hair growing out.
Yeah, it doesn't work with me, but hey, I have male pattern baldness, which is what all the men have.
You've looked the same for as long as I've known you.
I'm immortal.
You are. Like, I swear, you have not changed in the 16 years I've known you.
I'm immortal.
I should show a picture.
Great. I'm just joking. God, don't hit me with a ton of snow tonight and kill me, please.
Let's try and find a
picture. There's a lot of snow out there. No, let's not try and find a picture.
You look exactly the same. I have to show them.
I actually look better because I've lost a lot of weight. So.
You look exactly the same. I'm going to try and show you guys.
That's really crude.
This is him. It's like 16 years ago and him now. Doesn't he look exactly the same? Exactly. It's amazing. I don't know what you're on. Like, actually, I don't know. Maybe I do.
It's Mars glutathione.
There it is. Well, it's, NIH says it's the most anti-aging substance ever. And compared to the, I don't know if that's true compared to the next thing we're getting ready to get a patent on.
Ooh.
It's even bigger.
It's awesome. Back to birth control. Is there a reason they should get testing done if they've stopped taking birth control, or do you think they're okay? That's kind of the question they asked.
I don't know. What, are they having problems or not?
They just said,
I was waiting for the other foot to
they said
shoe to
they
fall.
stopped taking their birth control pills. Is there a reason they should still get testing? That was it.
No, if they're doing fine, no.
But if you're not feeling good, then yeah.
Yeah, if you're feeling horrible and you're bleeding all over the place and you're like wanting to jump off a cliff, yeah, let's get some testing.
So what about weight gain on birth control pills and stopping?
Very common.
How do they get the weight off when they stop taking it and it's not coming off?
Natural progesterone causes weight loss, but also if you deal, it's so complicated to deal with your methylation issues, deal with all that stuff.
There's so much going on always.
Yeah.
So this lady said she never gets her period and doctors want to put her on birth control. What other options does she have?
What does she mean? She doesn't ovulate,
she
or
just
she
said
doesn't?
never get my period.
I don't know what that means. I'm
She
not
said
being,
she went an entire year without ever getting one.
But that doesn't mean she didn't ovulate
That's
every
true.
month. Is she carefully tracking temperatures?
She probably never bled.
There's a lot of women who don't bleed, but they're still ovulating.
Yeah.
So,
And that's okay if you don't get your bleeding.
but is she in menopause? That technically she's in menopause. If she's young, it's a vitamin deficiency caused by a genetic error. Hello, I've been preaching that. It's ovarian insufficiency or ovarian failure. So
something's going on. Sorry, a lot of the questions aren't always completely. I have to read them first so I can put them together.
I know it's hard.
Sometimes
I know hard. They're trying.
No,
so.
and I'm not a very good.
And then they laugh at me, and then they throw stuff.
I totally butcher some of the questions, I feel like.
I will be. There's a rumor. I don't know if this is true or not. I don't know yet, but there's a rumor. I'll
You're
be
starting your
speaking
own
a couple
rumor?
of times in the first week in January at Disney World. So if you happen to be going then and you see me,
Ooh.
wave and like that lady. Nice
Find him
lady
a
did.
zebra cupcake and bring it to him, and you'll make his life. Not even his day.
I've changed.
Oh
Cupcake,
no,
Cupcake desires.
he's changed his favorite cupcake.
Hang on, I had to write it down.
I can't believe.
Okay, Polynesian Resort, Captain Cook's chocolate macadamia cupcake, or maybe I've heard the orange passion fruit cupcake there is super good. Also, the Magic Kingdom at the confectionery, the colorful cupcakes are pretty cool. But let's go to the Hollywood Studios starring Rolls, the red velvet cheesecake cupcake.
Ooh, that
or
sounds
the
good.
peanut butter cup chocolate cupcake at starring Rolls. Okay, enough of that. Sorry, I did a little side there.
Dreaming about cupcakes, huh?
In Disney World.
Mm-hmm.
Hey, I'll go down there and work my buns off if I can spend a half a day in a park.
Yeah, of course you would. Sorry, I'm getting distracted by these questions. Can you use? I've gotten this so many times.
We were supposed to discuss the picture I put up too, because that's so many errors.
What picture?
Birth control. So it says, okay, let me go over migraines. Birth control may make migraines worse or better. Almost always makes them worse. Why does it make migraines worse? It's pro-inflammatory.
Oh
Causes
yeah, just
inflamed
making
blood
you hurt
vessels.
more.
Yeah, slightly increased risk of blood clots too. I agree with that. Appetite changes, a big increase. Usually, I've never seen a decrease. Bloating and nausea because you can't absorb that garbage. And it may stop you from making eggs, possible cancer prediction. I love this one. The types of birth control pills offers a bit of extra protection from uterine and ovarian cancer. What? No, it doesn't. It dramatically increases at 250%. So, anyway, whoever made that pictograph up is a bozo. Yeah.
Why do you find that a lot of people who take birth control pills have depression or anxiety or, those kind of...
They have been teach for. Those are synthetic, nasty synthetic hormones. Of course you would. So, yeah.
It's just not good.
It can make you crazy if you have methylation problems. And most people do. Especially most young living distributors have those problems. So, I wouldn't take them.
What do you think of Lupron for someone with debilitating migraines with aura, fainting, tremors, losing their hearing, and etc. during a
That's
migraine?
pretty severe. Hey, listen to your doctor, but the new big option out there is intranasal oxytocin, the love hormone, along with lots of natural progesterone. Look it up, Google it, search on PubMed, oxytocin for migraines, with Aura and all that. Not Aurora, but Aura.
Sorry, Disney on the brain. Aurora, Sleeping Beauty. That was totally off.
You got me now. Instead of the same thing you said.
Are hormones commonly linked to women with extreme anger or large swings in moods, or is this more of a vitamin mineral deficiency issue?
Both.
Just depends.
Yeah.
What do you do for fibroids? Sorry, we're getting a lot of random questions too. So
A lot of natural progesterone shrinks them 70% of the time.
Always goes back to the natural progesterone, doesn't it?
It's so beneficial for women. Fibroids are a sign that you've had a lot of low progesterone for a long time.
Wow.
So
That's interesting.
that's why you don't see it in 18-year-olds. You see fibroids in 40-year-olds.
What is a fibroid again?
It's just a leiomyoma. It's kind of a scar tumor. It's benign tumor in the uterus, and it can cause bleeding around and stuff like that. But it's from lack of progesterone.
Well. Yeah, we're at the hour mark, so we can start wrapping up if you'd like.
Are they bored?
No, but we're at the hour, and we can do this again soon.
Listen, if you have questions or you need help getting off your birth control pills, I'm here. Or go to a good compounding pharmacy near you and ask who a good doctor in the area is first who can help you. If not, I'm available. And it's one of the things I do every week. I help patients get off birth control pills. But I'd start with a lot of natural progesterone. And I'd really get a detailed history as to why you needed the birth control pills to begin with. It could be as simple as protection from pregnancy to you had this problem or that endometriosis or PCOS or something. I would never give a PCOS person, PCOS lady, a birth control pill. It's too pro-inflammatory and they already have too much of it. But anyway, PCOS, endometriosis, severe PMS, whatever. So trying to avoid them. It's easier to deal with that than deal with breast cancer later. And you'll still, guess what? You'll still have bad PMS, endometriosis, whatever, while you're going through breast cancer. It's a nightmare.
Not good.
So anyway, thank you for listening. I love you all. Thanks for always being so kind. And
check out the open seats for the lab class,
the
lab
sit-ins.
class.
So if you get your labs, we already have the premium seats are all filled. 15 of them filled up really fast. Told you they would. There's more seating available for the lab class. Bring your labs, look at them while we're going through this. I'll teach you what to look for, where to look at. And it's essentially like getting your labs read. And so there's still some seats available for that. They'll be gone quickly too. It's only, what is it?
$75.
Really?
You can't ever get an appointment with Dr. Purser for that much money.
So,
and he'll be educating on so much more. So
it'll be fun. And I told the one with the best premium labs, I'm sending him a Zebra Dome cupcake live from Disney World. And I can't guarantee it won't be smashed and beat up by the time he gets there, but you never know. Or maybe there'll be a bite missing out of it.
Gross. I thought you don't even like the Zebra Dome anymore.
Okay, maybe it's a red velvet cupcake that they might, I don't know. I'll decide the cupcake. We need, get your labs now because you only have a little over 4 weeks till I hold that class.
It's going to be really fun.
Yeah, it's going to be fun. It's Tuesday night, January 7th.
I think.
And then the 9th is a Facebook Live.
Yep. No, not the 9th. Oh, yeah. The 10th. No, okay. We got that totally wrong. No, I'm looking at the wrong year. What year is it, you guys?
It's gonna be 2020.
Yep, it's gonna be the 7th is the sit-in, the lab class, and the 9th is a Facebook
Yeah,
Live.
funny who said that.
Good
Nice.
job. I'm fired, not you.
You're accepting
I
my
fired
firing?
myself. How about that?
Finally,
How does that feel,
finally got
Dr.
rid of that dead weight. Oh,
Guys, this was my last one
Jackson,
ever.
You're gonna be reading the questions.
Brecken does a very good job. I'm not even going to touch that.
Some days,
What?
not today.
Honey, what are you doing? She's not answering me. It's my wife, Brecken's mom.
I'm back. Am I hired again?
But with a slight decrease in
I
pay.
rehired myself, so I'm back. So, also just a reminder, all our products are going to be 25% off on Physician Designed with the coupon code holidays 25% off. So that's a really fun. Get the cosmetics
Is the Pro
bars.
7 still on sale? Please
It's-
make it be on sale for you tonight.
Okay, we can turn it back on, I think. We'll turn it back on. We turned it off, but we'll turn the Pro 7 back on
Because I
tonight.
told some of the people wouldn't be over till tonight.
So it's still $100 off.
Where can they find the lab class?
Yeah.
Dan
I have
Purser
no
MD,
idea.
right on the homepage. It's right there.
Your
They
website.
tell me nothing.
We tell you everything.
Dan Purser MD, right there on the homepage, whatever that means. DanPurserMD.com. I guess it's the first page that comes up. Look for it.
Yeah.
There, the lab class. And you're crazy, you're cray-cray if you don't go to it.
It's going to be good.
Okay. I love you all. Take care. Go in good health and God bless.